Hi, it's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies, otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, also home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, as well as palliative care services at home. We are also sending our critical care nurses into the home or into a residential aged care to provide an emergency department bypass service. So, in today's blog post, I want to talk about a recent client that we just started servicing at home. The client is a young man who has unfortunately become a quadriplegic, and he's now having a tracheostomy and is dependent on the tracheostomy to live his daily life. Now, interestingly enough, the family said that, when he spent a lot of time in ICU, they were told that, their son and brother wouldn't have any quality of life, and they were encouraged to withdraw life support. But the family was adamant, saying, no, we're not going to withdraw life support. We want him to live. We want to take him home, and after a long journey in hospital, he finally came home, with the help of our service. Initially, they didn't know that our service existed. So they were trying to manage it themselves, and with some, support workers, that didn't work. Of course, the client ended up back in the hospital all the time. And now we just started there, and it looks like the situation is getting much better with having critical care nurses 24 hours a day, which is what is needed for tracheostomy care at home. When you look at the evidence-based mechanical home ventilation guidelines on our website at intensivecareathome.com, you will see that those mechanical home ventilation guidelines are evidence-based and are a result of nearly 30 years of intensive care at home nursing in Germany, but also of intensive care at home nursing for the last 10 years here in Australia with intensive care at home, because our service is evidence-based. And this is what clients in the community need. If they don't get evidence-based nursing care with specialist critical care nurses, clients are at risk of dying. And I'm unfortunately not exaggerating. I've made videos about clients that don't get the appropriate NDIS funding for specialized nursing care, have died in the community, and I've made videos about that before, and I have also evidence to back up what I'm saying here. So it is really important that if you have a loved one in intensive care with a tracheostomy, or if you have a loved one, on a hospital ward, on a respiratory ward with a tracheostomy, and you see no way forward, you should absolutely contact us here. And, so that we can help you to get your loved one home with the appropriate care, so they're not going back to hospital all the time, or even worse, So if you have a family member in a similar situation, reach out to us here at intensivecareathome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. We are currently operating all around Australia, in all major capital cities and in all regional and rural areas. We are an NDIS accredited service provider. We are a TAC approved service provider in Victoria, ICAH in New South Wales, and IISQ in Queensland. We are also a DVA approved service provider all around Australia. We and our clients have received funding through public hospitals, private health funds, as well as departments of health. We are also providing level 2 and level 3 NDIS support coordination, which would be critical in a situation like this to get NDIS funding in the first place. So if you don't have enough NDIS funding, or if you're not happy with your NDIS support coordinator, please reach out to us as well. And if you are an NDIS support coordinator from another organization and you're watching this and you are wondering how you can get nursing care for your NDIS participant, or if you need an NDIS nursing assessment, or if you need help with advocacy for your NDIS participant, please reach out to us. We can help you with all of that. We have been involved in most of the advocacy for all of our clients. Like I said, we have written lots of NDIS nursing assessments, and we continue to do so. And if you're a critical care nurse and you have a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, we want to hear from you as well. We currently have jobs in Sydney, Melbourne, Brisbane, in Albury, Wodonga, in Bendigo, as well as in Warragul in country Victoria. So we have a wide variety of job opportunities for critical care nurses that have the right mindset and the right skills. And also, we provide a tailor-made solution for our clients, which means we have regular staff with regular clients. And that means we are not a nursing agency. Sometimes critical care nurses come to us and say, oh, are you an agency? And I say, no, we're not an agency. We are a service provider that has a tailor-made solution for our clients. And that includes regular staff that do regular shifts. If you can't give regular availabilities, this is not for you. We are not an organization where people come and go. We are building relationships with our clients, and we want the same for you. We want you to build relationships with our clients. We want to build a relationship with you if you're interested in working for us. Now, and if you are an intensive care consultant or an ICU specialist and you're looking for a career change, we're also currently expanding our medical team. We want to hear from you. And if you are an intensive care specialist or ICU consultant working in ICU and you're looking to free up some of your ICU beds for your long-term stayers, we can help you eliminate those bed blocks and you're not even paying for it. And if you're a hospital executive watching this, we also want to hear from you because once again, we know you have bed blocks in your hospital, in your ICU and in your ED. We can help you eliminate all of that as well. And once again, you don't even pay for it. And all of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. Lastly, if you are in the US or in the UK and you need help, please reach out to us as well. We can help you there privately. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and also intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have. I also do a YouTube live weekly where you can answer, where I answer questions live on the show, and you can ask me there. Subscribe to my YouTube channel so that you get the notifications there when I do the YouTube live. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.